Welcome back to the channel. If you've ever felt overwhelmed trying to figure out which supplements actually work, you're not alone. From weight loss to stress and anxiety management, the supplement market is full of options, but not all of them are backed by solid evidence. Today, we're diving deep into some of the most commonly asked questions about supplements. Whether you're curious about berberine for metabolism or wondering which supplements might help reduce cortisol, this video is going to break it down for you. Let's get started. First up is berberine. This natural compound is gaining popularity for its potential to support metabolism and aid in weight loss, particularly for those dealing with insulin resistance or metabolic syndrome. Berberine works by activating an enzyme called AMPK, which is often referred to as your body's metabolic master switch. What does this mean? Well, it helps regulate your body's way of using energy, which in turn can lower blood sugar and improve insulin sensitivity. Research has shown that berberine can help people with type 2 diabetes and insulin resistance manage their blood sugar, and it's even being linked to weight loss. It's typically recommended in doses of about 500 milligrams 2 or 3 times a day with food. However, like any supplement, you'll want to check with your healthcare provider before adding it to your routine. Specifically, if you're already on medication for blood sugar or anything else, specifically if you have gut issues, because berberine is well known to cause gut issues and can even cause diarrhea, nausea, and vomiting in severe cases. So it's really important that you work with your healthcare provider to determine whether or not this is a good fit for you. And if it is, how specifically you are going to incorporate it into your plan. Now, let's talk about supplements for weight loss. What works and what doesn't? The market is full of supplements that claim to help with weight loss, but which ones are actually backed by science? Let's talk about the few most popular options. Number one is green tea extract. This is actually one of the better researched options. The active ingredient in green tea extract is EGCG and has been shown to increase fat burning, especially during exercise. It can also slightly boost your metabolism, which might help with overall weight loss when combined with healthy eating and physical activity. Number two is Garcinia cambogia. You've probably heard about this, but the evidence is pretty mixed. While some studies suggest it may reduce fat storage, others show minimal or no effect. It contains something called HCA or hydroxycitric acid, which is believed to block fat production, but the results are really not consistent across studies. CLA or conjugated linoleic acid. This is a fatty acid found naturally in meat and dairy products. It's often promoted for weight loss, but the results are modest at best. Some studies show small reductions in body fat, but it's not a magic solution. It's best to use CLA in combination with a healthy lifestyle rather than as a standalone approach. I find with my patients and people online, we're often just looking for that quick fix, that magic bullet, that thing that is going to change everything. The reality is that it takes so much more than one thing. And while some of these supplements can be helpful, we really need to look into some of the root causes as to why you are not losing weight. We need to look at the metabolic pieces that are going on, potentially due to hormones. For example, in perimenopause, we know that your metabolism is naturally going to decline. So we need to make sure that we are adjusting our plan and our strategy to accommodate for that. For example, by incorporating enough protein, by adding in strength training consistently to our treatment plan. These things can really help with metabolism. We also need to make sure that we're doing comprehensive blood work. So, looking at things like thyroid health, because if your thyroid is dysfunctional, that is going to influence your ability to burn calories or lose weight. Next up is supplements to reduce cortisol and manage stress. Stress is a major issue for many of us, and cortisol, our body's main stress hormone, can actually wreak havoc on our health if it's chronically elevated. Luckily, there are some supplements that can reduce cortisol and help how your body handles stress. Now, when I talk about cortisol, I often am talking about reducing it. But the reality is what we're doing a lot of the time is we are regulating it. And so most people don't actually have cortisol that's through the roof, super high. Most people just actually have a dysfunctional cortisol response. So, what does this mean? It means that your cortisol is probably high when it shouldn't be and low when it shouldn't be. Cortisol is supposed to go in a natural curve. This cortisol awakening response, we have it high in the morning And it should decline as we go throughout our day, being at its lowest level at the end of the day so that you can actually get a good sleep. And so, if this doesn't happen properly, we can be woken up in the middle of the night, 2 to 3 a.m., anyone. We can be not sleeping, not being able to fall asleep, feeling tired but wired, being exhausted during the day. But then when the evening comes, you have a boost of energy. Does this sound familiar? So, a lot of these herbs are known to modulate that response, make sure that it's high when it should be and low when it should be, rather than just bringing it down. Ashwagandha is an adaptogen that is one of the best research supplements for reducing cortisol levels. Studies have shown that people who take ashwagandha report lower cortisol levels and feel more relaxed. It's been studied for burnout, and it is used to help the body adapt to stress. What my patients say when they take ashwagandha is that they still encounter the same stressors, but they feel as though their body handles it a lot better. Number 2 is phosphatidylserine. This phospholipid is especially useful for reducing cortisol levels after physical stress, such as intense exercise. It can help your body recover faster and lower overall cortisol levels. Rhodiola is another powerful adaptogen. It's been studied for its ability to improve resilience to stress and actually combat mental fatigue. It's great for periods of burnout or high stress. I'm often using this in patients who have a little bit of anxiety or depression, but we again have to be super careful and make sure that we're speaking to a healthcare provider. So we are taking into consideration any interactions with your medications. And let's talk about supplements for anxiety, natural solutions for a calmer mind. Anxiety is something many of us deal with, and while lifestyle changes are key, there are some supplements that can offer additional support. Number 1 is magnesium. Magnesium is an essential mineral that plays a role in over 300 biochemical reactions in your body, including those that regulate your nervous system. Many people are deficient in magnesium, which may lead to increased anxiety. Taking magnesium bisglycinate is a great way to support relaxation without causing digestive issues. And when we're looking at magnesium, it's important to consider the type, right? When we look at magnesium, typically I break it into a few categories. The most common ones I'm using are magnesium citrate, magnesium bisglycinate, and magnesium threonate. Magnesium citrate is more likely to work on the bowels. And so partly what that does is we bring water into the bowels through an osmotic effect. And what that's going to do is it's going to make you have a bowel movement. So I'm often using magnesium citrate in situations where you might be constipated, for example. And magnesium bisglycinate is more likely to work on the muscles. It's more likely to be absorbed by the tissues. So I'm using magnesium bisglycinate for situations like sleep, restless leg, thyroid health, hormone health. I'm more likely to use a magnesium bisglycinate in those circumstances. Magnesium threonate, I'm mainly using for anxiety, but I find more often when I'm treating my patients, I'm using a two birds, one stone approach. And so, what I'm always looking to do is I'm looking to make sure that what I'm doing is going to have the best effect on everything. And so, if someone has poor sleep, restless leg, anxiety, I'm most likely going to use magnesium bisglycinate for that two bird, one stone approach. L-theanine is an amino acid found naturally in green tea, promotes relaxation without making you drowsy, and it works by increasing the level of calming brain chemicals like serotonin and dopamine. Studies show that it can help reduce stress and anxiety, making a good option for daytime use. In my patients, I often use it before bed, and I refer to it as the thing that turns the wheels off, right? If you're a list maker, if you're the person that's, struggling to fall asleep because you're thinking and the wheels are turning, I'm using L-theanine to help just shut that off and quiet it down. GABA is a neurotransmitter that helps to calm the nervous system. Supplementing with GABA can reduce feelings of anxiety and promote a sense of calm. Again, we need to make sure that we're speaking to our healthcare provider because if you are taking any medications, any mood meds, we need to compare and contrast and make sure that there is no interactions with your medications with these supplements. Just because it's natural does not necessarily make it safe. And so the last question is, what supplements should I take? Most people ask, what supplements should I take? As you can see, supplements can be a great tool for managing weight, stress, and anxiety, but it's important you understand that they aren't a one-size-fits-all solution. What works best for one person, what works best for your partner, your neighbor, your friend, may not necessarily work for you. The best way to figure out which supplements are right for you is actually to consult with a healthcare provider who can take a personalized approach based on your health needs and goals. To wrap things up, supplements can play an important role in supporting your overall health, but it's always crucial to base your choices on evidence and professional guidance. And if you're curious about incorporating any of these supplements into your routine, please make sure you consult a healthcare provider first. And remember, no supplement can replace a healthy diet, regular exercise, and proper sleep. If you want to dive deeper into any of the supplements we've talked about today, be sure to check out my blog post for more information on how these supplements can work and what the research says. Thank you so much for watching. If you found this video helpful, don't forget to give it a thumbs up, hit the subscribe button, and click the notification bell so you never miss a new video. See you next time, and take care of yourself.